Hi, I'm Jamie with Trauma, a PTSD blog, and today I want to talk about psych meds. It's a hard decision deciding to take psychiatric meds for PTSD. Some of the things that I had to consider before I started taking them were, do the benefits outweigh the risks? For me, that was a simple answer, and the answer was yes, because like many PTSD sufferers, what I was doing was self-medicating with alcohol, and that caused some really risky behavior, a lot of anger issues, and taking the proper medication was a much better choice for me. I did worry about the side effects, and there are some. However, there are a lot of medications that can be used for PTSD treatment, and it just takes a little bit of patience in finding the right regimen for you. So you can work with your psychiatrist and find the right medication. Sometimes it takes a few tries. It did for me. The next question that I ask myself is, does medication treatment improve my quality of life and the quality of life of the people around me? It's difficult to have PTSD, and it's difficult to be around people who have PTSD. So I had to consider the fact that taking medication regularly as prescribed definitely improves my quality of life, stabilizes my mood, helps with nightmares and depression, and it also helps my loved ones because they don't have to be around me when my anxiety is high and my depression is deep. Another thing to ask, and that I had to ask myself, is what are my real concerns about taking medication? Is it the stigma that goes along with having a mental health issue? Is it the fact that I don't want to be reliant on a drug for my recovery? Is it possibly even guilt, that I shouldn't have to take medication, or that I don't deserve to take medication to get better? Is it that I think that I should be able to get over it and not have the issues that people with PTSD have? Those are some things that need to be considered when you are deciding whether or not you want to take psychiatric meds for PTSD. Also, you need to consider what your expectations are. I joke with my husband sometimes when he asks if I'm grumpy or whatever, if I've taken my medicine. It's not magic. And it has to go hand in hand with therapy and other things in recovery. Medicine is not going to fix everything. I still from time to time have nightmares. I still from time to time have anxiety and depression, and that stuff doesn't go away completely with medication. So talk to your psychiatrist, see what they think is best for you, educate yourself, and decide whether or not you should take psychiatric meds for your PTSD.